Hi, I'm Stephanie Moore with UnityPoint Health, and I'm joined here with Dr. Dodge, one of our pediatricians. And this week we're going to talk about a topic that is in the news a lot, and that is the measles outbreak that's going on right now. And the CDC recently reported that the measles was almost eradicated in the year 2000, but we're seeing this huge uptick right now. Kind of remind us just from the basics, what is the measles and what are some of the symptoms?
So measles is a virus. It causes fever, cough, runny nose, red eyes, and a rash.
Why is this such a dangerous virus?
You know, measles is a virus that spreads quickly. So for every one person who gets infected, about 9 out of 10 people that they come into contact with who haven't been vaccinated will get the disease. So, for the flu, if I have the flu and generally about 6 other people will get the flu if I've had the flu. If I have measles, about 20 other people will get measles. So it spreads pretty quickly. It also can cause pretty significant illness. About 1 out of 10 kids will get a bad diarrhea illness. About 1 out of 20 will get pneumonia. About 1 out of 1,000 will get swelling of their brain. And really 1 to 2 out of 1,000 will die.
So it's very, very serious.
Correct.
Like I said before, it was almost eradicated in the year 2000. How long is it going to take us to get back to those numbers where we weren't seeing it in the news every day?
I think the problem is now we have a lot more people who are afraid to get their kids vaccinated. And until we get those vaccine numbers up, we're going to continue to see these outbreaks. We really do need about 90% of the population vaccinated to rely on what we call herd immunity so that we don't see these kinds of outbreaks again.
It seems like it's spreading really quickly. We're seeing it. You can't watch the news or read the newspaper without hearing about another outbreak, even here in Iowa. Is it spreading quickly, or is this just part of the virus's path?
It's part of the virus's path, but this year we've had more cases of measles in this year than we did in the 5 years combined before now. So we are seeing more of it.
How many vaccines do kiddos need, and when do they start getting those?
So generally, kids will get their first MMR vaccine between 12 and 15 months, and then their second one between ages 4 and 6 years.
So maybe you're between that. Your kids got the first vaccine, but not the second. Is there anything you need to do to protect them?
The really nice thing about the measles vaccine is after the first vaccine, you're about 93 to 97% protected. So that second one gets you pretty much all the way protected. So really, you don't have to worry too much if you got the first one.
What about those little kiddos before the first vaccine?
So with those kids, just be smart. If you're going to be traveling to areas where you know that there are huge measles outbreaks, talk to your doctor and see if your child qualifies. We can give vaccine as early as 6 months, though the immune response to that vaccine is pretty poor, so it doesn't count in your 2 that are needed. But we can do some things to help out if you're going to be going to an area where there's a lot of measles.
And then let's talk about maybe the people born in the 80s or before that maybe only got 1 vaccine. Was that just the protocol back then, and do they need a second one?
So that was the protocol. That really has to do with the fact that the measles vaccine is super effective. So in general, the reason why we give a second MMR, in addition to catching those small percentage that weren't immune from the first, is because of the mumps. So you really don't need to worry.
Is this more dangerous for kids or adults, or is it that population of the young and the old?
It really is the young and the old. The babies, the really young, school age seems to do the best, and then older adults. People who are immune compromised for any reason too are at risk.
You hear about people getting the chickenpox after the chickenpox vaccine. Can you still get measles or mumps after you've been vaccinated?
You can get mumps, and you can rarely get measles, but super rare.
Another push to get the vaccine.
Another push to get the vaccine.
What are people saying around your clinic? I talked to a couple nurses. They said a lot of parents are calling, very worried. What's the buzz?
Parents are terrified. Parents are terrified that they can't go someplace without their child being vaccinated. Parents who vaccinate are upset with parents who are choosing not to vaccinate because it's putting their children at risk, especially those parents who have babies who can't be vaccinated yet.
What's your final push if someone's maybe on the fence? Should I vaccinate? Should I not? What are you telling them in these appointments?
The reality is vaccines are safe. I think that there's a lot of distrust over vaccines. There's a lot of concern that vaccines could potentially cause more harm than good. I promise you that that's not the case. I wouldn't have vaccinated my own children fully if that were the case. I think that there's concerns that maybe we push vaccines because we make money. I know my clinic loses thousands of dollars a year because we vaccinate, but we vaccinate because it's important.
So the final message is, if you haven't vaccinated, please go vaccinate your children.
Correct.
All right. Thank you, Dr. Dodge, for joining us.